the disease process of generalized anxiety disorder. Generalized anxiety disorder. It is characterized by excessive anxiety and worry about a number of activities or events that is present more days than not for a period of at least 6 months. An example situation of people with God is they anticipate disaster and may be overly concerned about money, health, family, work, or other issues. So the exact etiology is not established, but associated factors include the biologic vulnerability. It is most likely associated with neurotransmitter abnormalities such as the GABA, serotonin, norepinephrine within the limbic system. Next is the gender, wherein women are affected twice as often as men. Next is the other psychiatric disorders. So high comorbidity rate with other psychiatric disorder including major depression and panic disorder. Lastly is the psychosocial factors such as low self-esteem, decreased tolerance for stress, and tendency toward external locus of control beliefs. So, according to Mayo Clinic, an imbalance of naturally occurring brain chemicals called neurotransmitters such as serotonin, dopamine, and norepinephrine is often seen in people with GAD, and it could be an indicator of a propensity to develop the disorder. And according to Dr. Andrew Gilbert, a psychiatrist and medical director at the Hallowell Center in New York, it is likely due to a combination of stress and environmental factors that contribute to the expression of genes in individuals who are born with a risk or vulnerability to develop the condition.
Good day everyone, so to further know more about the generalized anxiety disorders, I'll be discussing to you the 4 levels of anxiety, in which we have the mild, moderate, severe, and panic level. Talking about anxiety has both healthy and harmful aspects depending on its degree and duration as well as on how well the person copes with it. The first level is mild anxiety. It is a sensation that something is different and warrants special attention. Because at this level, the sensory stimulation increases and it will help the person to focus attention to learn, solve problems, think, act, feel, and protect himself or herself. It often motivates people to make changes or to engage in goal-directed activity. So for example, it helps a student to focus more on studying for an examination. And although it is often described as subclinical or clinically non-significant, the mild anxiety level can still impact the emotional, social, and professional functioning because it tends to be when you have an irritating symptoms that don't seem to go away, but that otherwise doesn't control you. For example, you have constant worries but you can generally ignore them. You may feel nervous, nauseated, shaky, or even sweaty, but you aren't weakened by any of those symptoms. Mild anxiety symptoms may present as social anxiety or what we call shyness and can be experienced in your early childhood throughout your adulthood. If left unaddressed, the mild anxiety level can lead to maladaptive coping strategies or more severe mental conditions. Moderate anxiety, on the other hand, have more frequent or persistent symptoms than those with mild anxiety. In this level of anxiety, there is this disturbing feeling that something is definitely wrong. The person then becomes nervous or agitated. The person can still process the information though, they can still solve problems and learn new things with assistance from others. Though he or she has difficulty concentrating independently, but they can still be redirected to the topic. For example, the nurse might be giving pre-operative instructions to the client who is anxious about the upcoming surgical procedure. As the nurse is teaching, the client's attention wanders, but the nurse can regain the client's attention and direct him or her back to the task at hand. The client's attention can wander, and he or she may have some difficulty concentrating over time. So speaking in short, simple, and easy to understand sentences is effective. The nurse must stop to ensure that the client is still taking the information correctly. Although moderate anxiety symptoms are disruptive, people with moderate anxiety may have success in managing their anxiety with the help of a doctor or self-help strategies. When anxiety becomes severe, the client no longer can pay attention or take in information. A person with severe anxiety has trouble thinking and reasoning. The muscle tighten and the vital signs increases. The person's faces is restless, irritable, and angry, or they uses other similar emotional psychomotor means to release the tension. These symptoms can result in loss of work and increased healthcare costs. In addition, the individuals with severe anxiety may turn to alcohol and drugs as a mean to cope with their symptoms. It is also essential to remain with the person because anxiety is likely to worsen if he or she is left alone. Talking to the client in a low, calm, and soothing voice can help. And if the person cannot sit still, walking with him or her while talking can be effective. When the nurse talks about matters less than how he or she says the words. Helping the person to take deep, even breaths can help lower the anxiety. Lastly, in the panic anxiety level, the emotional psychomotor takes control with the accompanying fight, flight, or freeze responses. The adrenaline greatly increases the vital signs as the pupils enlarge to let in more light, and the only cognitive process focuses on the person's defense. So during the panic level anxiety, the person's safety is the most primary concern. He or she cannot perceive potential harm and may have no capacity for rational thought. The nurse must keep talking to the person in a comforting manner. Even though the client cannot process what the nurse is saying, going to a small, quiet, and unstimulating environment may help to reduce the anxiety. The nurse can reassure the person that this is anxiety and that it will pass, and that he or she is in a safe place. The nurse should remain with the client until the panic recedes, as the panic anxiety is not sustained indefinitely but can last from 5 to 30 minutes. The trigger of the panic attacks vary from person to person, and the cause of an attack may be familiar to a person or unknown. Therefore, people with anxiety, especially when not treated, have the higher risk of leading a life of isolation, which would also lead to other mental health disorders such as generalized anxiety disorder or GAD. When their anxiety level is mild to moderate or with treatment, people with GAD can function socially, can have full and meaningful lives, and be gainfully employed. But many with GAD may avoid situations because they have the disorder, or they may not take advantage of opportunities due to their worries. And due to that worry, some people with GAD can have difficulty carrying out the simplest daily activities when their anxiety is severe.
I'm Rikami Manago and I'll be discussing the signs and symptoms of generalized anxiety disorder.
Generalized anxiety disorder usually involves a persistent feeling or anxiety or dread which can interfere with daily life. It is not the same as occasionally worrying about things or experiencing anxiety due to stressful life events. People with living with God experience frequent anxiety for months, if not years. Signs and symptoms of God include feeling restless, wound up or on edge, being easily fatigued, having difficulty concentrating, being irritable, having headaches or unexplained pains, difficulty controlling feelings of worry, having sleep problems such as difficulty falling or staying asleep.
I am John Dixie Gaspi and I'll be talking about the treatment for general anxiety disorder. Diagnosis. To help diagnose general anxiety disorder, your doctor or mental health professional may do a physical exam to look for signs that your anxiety may be linked to medications or an underlying medical condition. Order blood or urine test or other tests if a medical condition is suspected. Ask detailed questions about your symptoms and medical history. Use psychological questionnaires to help determine diagnosis. Use the criteria listed in the Diagnostic and Statistical Manual of Mental Disorders (DCM-5), published by the American Psychiatric Association. Psychotherapy. Psychotherapy is a popular form of treatment for JD or general anxiety disorder. Talk therapy can be performed by a variety of mental health professionals, and though the approach described below can overlap, they are guided by different theories and emphasis. Cognitive behavioral therapy. Cognitive behavioral therapy, or CBT, is the gold standard of psychotherapy and, one of the most popular treatments for GAD, proven to work for adults just as effectively as it does for younger patients. CBT focuses on present difficulties and current situations. CBT is a short-term, structured treatment that focuses on the interplay between the conscious thoughts, feelings, and behaviors that perpetuate anxiety. Anxiety and commitment therapy, or ACT, is another present and problem-focused talk therapy used to treat JD. Also similar to CBT, the goal of ACT is to reduce the struggle to control anxious thoughts or uncomfortable sensations and increase involvement in the meaningful activities that align with the chosen life values. ACT can produce symptom improvement in people with JD and may be a particular good fit for older adults. Other talk therapies. Two other types of talk therapy, psychodynamic therapy and interpersonal psychotherapy, can also be used in the treatment of JD. Psychodynamic psychotherapy, also known as insight oriented therapy, is based on the idea that thoughts and emotions that are outside of our consciousness, outside of our awareness, can lead to internal conflict and manifest as anxiety. Interpersonal psychotherapy, or APT, is a time limited, present focused treatment based on the assumptions that symptoms may be caused or maintained by the problems in relationships, and that resolving this problem can help reduce symptoms. Medications. Several types of medications are used to treat general anxiety disorder, or JAD. Include those below. Talk with your doctor about benefits, risks, and possible side effects. Antidepressants. Antidepressants include medication that's selective serotonin reuptake inhibitor, or CCRE, and serotonin and norepinephrine reuptake inhibitor, or CSNRE. Classes are the first line medication treatments. Example of antidepressants used to treat general anxiety disorder include Aziz, Estilapron, escitalopram, duloxetine, venlafaxine, and paroxetine. Your doctor may also include other your doctor also may recommend other antidepressants. Buspirone, an anxiety medication called buspirone, may be used on an ongoing basis. As with most antidepressants, it typically takes up to several weeks to become fully effective. Benzodiazepine, in limited circumstances, your doctor may prescribe a benzodiazepine for relief of anxiety symptoms. These sedatives are generally used only for relieving acute anxiety on a short-term basis because they habit habit forming. These medications are good choice if you have or had problems with alcohol or drug abuse. Lifestyle and home remedies. While most people with anxiety disorders need psychotherapy or medications to get anxiety under control, lifestyles changes also can make a difference. Here's what you can do. Keep physically active. Develop a routine so that you're physically active most days of the week. Exercise is a powerful stress reducer. It may improve your health, your mood, and help you can stay healthy. Start out slowly and gradually increase the amount and intensity of your activities. Make sleep a priority. Do what you do what you can to make sure you're getting enough sleep to feel rested. If you aren't sleeping well, see your doctor. Use relaxation techniques. Visualize techniques, meditation, and yoga are examples of relaxation techniques that ease anxiety. Eat healthy. Healthy eating, such as focusing on vegetables, fruits, whole grains, and fish, may be linked to reduce anxiety, but more research is needed. Avoid alcohol and recreational drugs. These substances can worsen anxiety. Quit smoking and cut back or quit drinking coffee, both nicotine and caffeine.